Hello and welcome to the presentation on the facility-wide digital health solution using the OpenMRS in Kenya. Your presenter is Polycarp Otieno, Regional Health Digital Health Lead working with USAID Health IT project. The facility-wide digital health solution session seeks to demonstrate the application of OpenMRS as part of the public good in development and deployment of an end-to-end electronic health records. This was occasioned by the requirement by the county governments from our devolved government system to acquire systems that would help them manage both administrative and clinical functions. In order to enhance this and also maintain sustainability, there was a call for having systems that would be able to make them work or operate in this kind of form. Over time, this had been a challenge as proprietary systems came into being, and therefore, through the support and concerted efforts from the USG and other partners, the development of systems came up, and Kenya EMR, being one of them, was brought up into play to help develop and also make aim in what was being required. And in order to do this, the digitalization process has been ongoing through the use of better systems that could help us manage what would work for the teams that are at the county level. So by getting into the open systems and open source standards, Kenya EMR, being a bistro of the global OpenMRS, became useful to us in terms of modernization and digitization of the health facilities. So why facility-wide EMR? The facility digitization was aimed at supporting the administration and the facility clinical functions. This also being the development of the acts in Kenya, which relates to the Social Health Act that made a requirement for facilities to have an electronic system that will support the legal requirements of the facility. In terms of digitization, also there has been a move to limit or reduce the number of physical tools that are being put into use. And therefore, by getting into this, there has been a need for us to promote the use of tools via the system and digitizing them so that they are making the work easier for the teams. The other item is about the promotion of accountability amongst the teams that work within facilities, health commodities tracking, billing and finance functions, linkage and service integration with other systems, which is a major plus for the system that we have. Facility-wide data collection and streamlined reporting for the teams that are working within the facilities. This means that the current system allows for service integration between the common services that are being done within the facilities. And this includes from registration of patients from the moment they get into the facility, being followed through the triaging process to being sent to the various clinics, be they special clinics or be they the normal clinics that they are being able to use. Then linkage to the general medical services within the facility, which includes working with the laboratory, working with the pharmacy, and working with the other teams that require services of the special services within the facility. So through the facility-wide system, we are taking note that our facilities currently the ones who have uptaken this, and we are talking about 24 facilities within the country that are currently operating the Kenya EMR Plus, that there has been increased use and savings in terms of the cost that would have been paid in acquiring proprietary systems. But also, in addition to that, there has been savings in cost in terms of the monies that would have been used in printing of tools and capturing the other items that they could have easily worked on if they were to use the proprietary systems. Going forward, we are looking into an integration process that would allow us to use the system brought into the other areas. Thank you and welcome.